Dr. Erica here. Please like, share, and subscribe if you haven't already. Dr. Erica Onagbola, pharmacist, my main Erica OnagbolaPharmd. Today I'm talking about two monoclonal antibody medications that are new on the market, Praxbind and Ebglyss, which is particularly for the binding of a medication for Praxbind and for binding of the molecule that encourages the ectopic dermatitis. So the two medications are monoclonal antibodies. They pretty much do the same thing. They bind to remove, and when they bind, which is their mechanism of action, they remove the substrate from the site of action. And like a baseball mitten, it actually binds to the baseball, and then the ball is removed from the game altogether. And so that's, if you, I can give that analogy, that's what I would compare it to. So in this video, I just wanted to mention those two new monoclonal antibody medications newly on the market. Praxbind is more for emergency situations in the hospital setting or emergency room, or for a quick reversal, particular outpatient surgery or inpatient patient surgery against the antithrombin medication, the Bigatran or Pradaxa. I studied the Bigatran back in clinicals during my college years, and when I did that, there were no reversal antidotes for the Bigatran. Now there is, and it's the Praxbind, or the monoclonal antibody that they have recently put on the market, which is a new accomplishment for pharmaceuticals. And how it works is that it's going to bind directly to the Bigatran, which is dosed twice daily usually. It's going to bind to the substrate of the Bigatran, remove it from the site of action, and then we're going to see the clotting factors that are going to occur. The Bigatran can be used in non-valvular afibrillation patients, or non-valvular AFib patients who are looking to have a better longevity of life, and trying to prevent stroke and cardiovascular issues. So that is when you're going to see the Bigatran being prescribed. Now, the new antidote for the Bigatran is going to be IV only, intravenous only, because it's going to be given in the hospital setting. It is only for um, emergency situations or surgical situations. It's not a at-home dosing medication. So it's liquid form, and it's given IV. And the New England Journal of Medicine has done some research, and the American Heart Association Journal has also done some research to give it an FDA approval. So it is officially FDA approved, and it is on the market. Praxbind is the brand name, and it's only exclusively used for that reason, in two consecutive 2.5 gram dosage, no more than 15 minutes apart. Side effects are usually going to include hypokalemia, or decrease in potassium, and then delirium, constipation, fever, pneumonia, to name a few, headache, um, hypersensitivity reaction, possibly. So it says also that signs should be monitored very well to make sure there is no adverse effects that could possibly occur with Praxbind. So I'm happy because once that came on the market. There's an antidote for the Bigatran or Pradaxa. There's, I believe, over 2 million prescribed um, patients out there who are taking the Bigatran on a scheduled, regular basis. So it's very important that we do have some sort of antidote or some sort of preventative available when needed to be used as soon as available or as soon as possible. And now we do have that available. So um, that is a great, great innovation, and hooray for pharmaceuticals on that. Reversal agent Praxbind. Okay, the next medication is Ebglyss, which is another monoclonal antibody, and it is going to be used for ectopic dermatitis or excessive or severe acne. And how it works is that it's going to bind to the IL-13 substrate, which, when accumulating, causes a inflammation. It causes redness. It causes uh, redness in the site, inflammation, irritation. And when the monoclonal antibody is utilized, then that is going to act like, again, a mitten, and the baseball is going to catch the IL-13, remove the IL-13 from the site of action, and then we're going to see less of an effect, which is going to cause less skin irritation. So the the analogy is the same. The only difference is that we're actually um, targeting a cool entity or element rather than binding to a drug. This monoclonal antibody is binding directly to the element IL-13, or the biological molecule that we naturally produce, and we're removing that from the site of action. So that's what we get with the Ebglyss dosing. Ebglyss dosing is not IV. It's going to be sub-Q dosing, and it can be sub-Q dosed um, with a loading dose for 2 weeks, and then after that, it's going to be at a set point, and it can be used in ages 12 and above. Again, age 12 or at least 40-kilogram weight, and then adults as well. And it's recommended to use at home, rotating the site of injection, abdomen, upper arm. It could be thigh area, or it could be given by a caregiver. However, it is recommended that it be injected at a different site. However, if not possible, have a caregiver to help with that. Assess initial dosing and subsequent dosing. Maintenance schedule scheduled. There's no sporadic use for it. It just should be used on a regular basis. By being a monoclonal antibody economically, there will be some expenses with it usually. There might be a manufacturer's coupon that you can initially start off with, if not giving samples. I would suggest that if you have prescription a good prescription insurance, then do utilize that prescription insurance. If not, then do I guess, contact the manufacturer if you're not getting samples, to find out if there's a voucher that you can use to get this at a reduced or zeroed price at your pharmacy. So that's what I wanted to mention. For these two monoclonal antibodies. If you have questions, comments, please like, share, and subscribe. Let me know if there's any other topics you would like to learn about. And I'm Dr. Erica signing off. Take care. Bye bye.